So I will be presenting today like I'm presenting to my preceptors. So I just saw a 28-year-old African-American female with a history of asthma. Her last hospitalization was at age 16 and she's never required intubation. She presents today with a 2-day history of wheezing and shortness of breath following exposure to her cousin's cat, which caused a near asthma attack. Her severity during this attack was an 8 out of 10 for shortness of breath and a 6 out of 10 for wheezing. At that time, she used her albuterol inhaler, which helped, but it did not completely resolve her symptoms. Currently, she's having 10 episodes of wheezing and shortness of breath every 4 hours, with her last episode being this morning. She wakes twice per night with shortness of breath. Her shortness of breath is worse when laying down, and when she exerts herself, her shortness of breath is accompanied by a non-productive cough. Her symptoms are beginning to affect her daily activities, and she feels her albuterol inhaler is not working as well as it used to. Currently, the patient does not follow with a pulmonologist or an allergist. She's not aware of any environmental exposures or irritants in her home. She does not have a nebulizer at home. She also does not use spirometry, peak flow, or record any of her attacks. She does not use any tobacco, alcohol, or illicit drugs. I did examine her. She is in no acute distress, sitting upright on the exam table. Her lungs are have bilateral expiratory wheezes in the posterior lower lobes. There were no crackles on auscultation. Her chest expansion is symmetrical with respirations. She has normal fremitus, symmetric bilaterally. Her chest is resonant to percussion without dullness present. We did do a spirometry in the office, which showed her FVC was 3.91 liters. Her FEV1 FVC ratio was 80.56%, and her SpO2 was 97%. Potential diagnoses for her would be allergy-induced asthma and asthma exacerbation. Using the GINA guidelines, I would recommend treating this patient for her current exacerbation with oral corticosteroids such as prednisone, 20 milligrams BID times 5 days. I would want her to follow up in 1 week. During that follow-up, I would want to find out more about her symptoms outside of this exacerbation. If she does have symptoms outside of the exacerbation, I would prescribe a maintenance medication for her, such as Symbicort, which is an ICS for Formoterol. I would prescribe this at 2 puffs BID. And at the lowest dose, which is 80 mics per 4.5, because I can always titrate up. For rescue relief for her, I would also use the Symbicort because Gina's moving away from albuterol. I would do the Symbicort 1 to 2 puffs every 4 hours as needed. If she is not having any symptoms outside of this exacerbation, I would just prescribe her the rescue relief, the ICS for Formoterol or the Symbicort, 1 to 2 puffs every 4 hours as needed. I would also recommend she avoids triggers such as her cousin's cat, washing her hands, cleaning her linens. I would also recommend she follows up with pulmonology and an allergist.